I am a clinical psychologist. My practice is in Chevy Chase, Maryland, right over the DC line. And this is my second career. I was a lawyer before, and I basically work with adolescents, teenagers, and young adults. The key is that probably pretty much drive everybody crazy when they're trying to figure out how to be an adult. I work a lot with people around school-based issues. And I'm a writer and speaker nationally on mental health disparities, race, anxiety, depression, all the things that go around being a teenager and getting up and out of your house. So I just want to lay out to you that, like Danielle said, first of all, Danielle, thank you for all your hard work. These programs do not get organized in and of themselves. So I really appreciate you for making it easy for me. And for you all, I feel quite comfortable with you all putting things in the chat while I'm speaking. And so if you want to do so, please do. So we're going to talk about the world pre-COVID for a second. If you can remember back so far in the good old days before COVID, we're going to talk a little bit about pre-COVID days and the stresses that your children face. We're going to talk a little bit about COVID stressors and their impact, mental health wise, academic wise. We're going to talk a little bit about barriers to mental health. Some of them were in place before COVID, and some of them are new. And then we're going to talk a little bit about general solutions. Like, there are things that you can do other than therapy in your home to make it better for your children and for your family. So that's what we're going to talk about tonight. And without further ado, I'm going to get started. So the world pre-COVID, stressors were already going up on our young people. And because they had all these things changing, running up against things that stayed the same. So like all of their activities are going up, but it's matched against child development and all these things that have stayed the same. So there's a pressures on your child's internal system to be able to deliver. So what's changed? Academic rigor. My son read Animal Farm in 7th grade. I read Animal Farm in 12th grade. I didn't take algebra until high school, right? A lot of our young people are taking it well early into middle school. So academic rigor, and they're front loaded, meaning that you take these things earlier. Social pressures are changed. When I worked in a middle school counseling office, we had more kids who were using drugs and alcohol in middle school. So everything is front loaded socially also. There's also like so many activities that you have to fill in a week. So their kids are time pressured. They have to be involved in outside activities. Most of the parents are working, but one or either both parents are working full time. Also, obviously, social media has changed. So there's like a publication and a pressure to publicize that your child is doing well and that they're accomplishing things. There's also this need to be good at more than one thing in order to get into a, quote, good college. You have to be a good academician. You're supposed to be good at some other things. So these things are all adding stress to your child's life. So what hasn't changed, right? What hasn't changed is that child development remains the same. The child's emotional and physical development have remained basically the same. So they didn't get bigger brains. They didn't get better emotions to go along with those increasing demands. They have the same ones. They also have the same basic executive functioning capability. So they're no better organizers than kids were 20 years ago. In addition, your brain sensitive periods have remained pretty much intact. So what a sensitive period is this idea that your brain will learn the thing when it's ready. And when it's ready, it's ripe to learn the thing. So if your mind learns how to go from simple writing to abstract writing in the 9th grade, if you have schoolwork that's still in the 7th grade that's really complex, your mind is no more better to do it and you won't do well. So the sensitive periods have changed, but we front loaded the academics, and thereby kids have more struggles academically. And finally, because we're in this part of the country, you got to talk about the top colleges. The holy grail in this area of the country for a lot of parents is getting into a top college, but those slots have remained the same. So it's not like they've expanded. We have more amount of kids competing for less slots. Now, I should tell you this, we have less kids going to college overall because the population is decreasing and we're past the last baby boom. But the number of people kids trying to go to top schools has increased substantially. So then we have this thing called COVID-19, which came into this country in January. We had the first deaths at the end of January, early February of 2020. So now we're over a year since the first cases of COVID appeared in the United States. Unfortunately, we're up to 500,000 deaths. Up to 50,000 African Americans and Latinos is a little bit less than that, but the proportion of people of color who have died of this disease is way high. So what do we know? What is the data telling us about the impact of our kids in school? The preliminary data so far is telling us that math is one of the big impactors, and that is logical, because math is really a form, it's really related to the instruction. And so not having in-person learning means that last year when they measured this, the math performance have gone down. And also not surprising is that in low-income zip codes, the performance has decreased even further. So we have math, we show math declines because the kids are not in person. And for poor kids from poor zip codes, that has gone up even further. We also see a lot of economic divide issues. So we have kids who at the top end of the economic income ladder who are logging in every day. Nearly 83% of families with students with higher income families are logging in every day. But less 38% of families with low income families are logging in once a week or less. So we have this real disparity in terms of impact, in terms of the digital divide. We're also seeing missing school absenteeism, reading grade retention, graduation, dropout rates all going in the wrong direction because of COVID. Remote learning is exacerbating the impact of income disparity. So other groups who are reporting to have their needs not as well met are children with disabilities, the special needs, learning problems, and ADHD. And one study reported that about 40% of the kids in special ed say that their support is not the way it was pre-COVID. So we then start to look at what are the impacts other than in the classroom or the digital? We have kids who are traumatized, and there's no other nice way to say it. They are traumatized. This has been an event that has caused them pain. They're grieving. They're lost their routines. They can't celebrate the first day of kindergarten because they're not in kindergarten. They can't go to the prom. They've lost their closeness with their peer groups and teachers. They have had to fight off catching COVID and to keep their families from catching COVID. And all of this has taken place in some of the most unrest in terms of race, civil unrest, and police brutality that we've seen in our lifetimes. So it's not just COVID-19. There's many people talking about the double pandemics. Also, financial hardships. Many of our kids' parents have lost their jobs, or they've had to get other jobs where their income has been reduced. That people are reporting that they're more in food lines. There's one right around the corner from my house, and every Thursday the car line is getting longer and longer for the pantry that's near my house. So even prior to COVID, we were dealing with about 20% of the kids in the country dealing with the mental health, behavior, or ADHD. But even then, only 20% of that 20%, if that makes sense to you, was getting help. And so in that backdrop, before COVID, the rates of depression, anxiety, and suicide were rising. Since COVID, the CDC has reported at a record high 30% of Americans are reporting symptoms of anxiety and depression. That is the highest since the country started recording mental health statistics. So if you have any questions about this, just put it in the chat and let me know, and I will look at it. So this slide is unfortunately pretty easy. All the bad things are up since COVID. The anxiety and depression rates are up, suicide rates have increased, hospitalizations are up, alcohol and drug abuse relapses are up, and eating disorder, both relapses and onset, are up. So the isolation, the lack of school, the family issues, economic tightness have had an impact on our children and on us, and it's profound. The ones that I really want to focus on are the loss of social contact, because as a therapist, this is a big one. Because I don't think people realize it's not just that you don't have your friends around, it's you learn how to make relationships because of your relationships with your friends. Right? You learn how to socialize. You learn what's acceptable discourse. You learn a lot of things, nonverbal communication, all these things you learn via contact with your peers. And in addition, kids typically get a lot out of their having good relationships with their teachers. And because teachers often provide nurturing, they're what they call in local parents. They provide parenting during the school day. Now, somebody just asked about how do they gather the statistics? They do surveys, they use census data, which was being collected coincidentally during COVID. They have hospitalization data. They get data from all sorts of sources. These are where the numbers are starting to trickle in. I hope that answered your question. So kids miss their teachers because the teachers are often a source of love and nurturing and help to grow your child. Relationships with adults other than their parents are crucial. And in the last year or so, kids haven't had that. So this is a subtle point, but it needs to be made. This COVID situation has forced us and our children into making decisions that they're not ready to make. So, for example, they are being tasked with protecting their loved ones from COVID. And they're being asked to be mature enough to forego their friends. So you're asking a 7th grader to not see their friend who's next door, and they're just not developmentally ready for that. Even high schoolers, it's so tempting to have that social contact because we're asking them to protect their family members in life or death. And so they're in the developmental phase where they would be testing rules, they'd be breaking rules. And so this level of decision making is not necessarily appropriate to their age. So what we see is we see these children. There was a story on television last week of this child apologizing for giving COVID to his family members. And he was crying and upset. But I'm submitting to you that this child was probably too young to make these and hold these responsibilities of COVID. And it's very sad, the guilt-ridden children that we're seeing. So we're even seeing family stress. There's a Vanderbilt study that came out saying that a quarter of the parents said that their mental health declined. And 14% of the families said that their children's mental health declined. So we actually see parents saying that they're more mentally stressed than their children. And for those of you with high school students, it's kids that are ready to go to college, this is a particularly tough time. They don't get to do the rituals that they normally get to do that makes college admission run. They don't get to go see campuses. Their standardized testing is disruptive, if not upended. The college admissions process has been upended. And they, again, we're placing a lot of developmental expectations on them that may or may not be real. And because of that, their individuation is being stunted. And so what I mean by when I say individuation, I mean the part of the kid that is supposed to, the 17 and 18-year-old, that is supposed to be maturing enough so that they ramp up in order to be able to leave your home and take care of themselves. And individuation is a process. And that process has been interrupted by COVID because they haven't had the increasing amount of freedoms that you give your junior and senior, where you start trusting them with driving. You start trusting them to make decisions around dating. You start trusting them to make decisions around alcohol and parties. And you start trusting them to go fly somewhere by themselves. All of the things that we do to ramp up our child toward maturity, we're missing because of COVID. So one of the someone put in the chat that they have junior and senior. So those of you with juniors and seniors, you can fully get behind the fact that this process is not like your other children's process, or indeed like any that we've seen. So we have this increasing issue of even before COVID, most mood disorders weren't treated. Some studies say up to 80%. In certain minority cultures, there's a 10-year time frame between between the onset of the disorder and the treatment. So if your kid starts to have depression, in some communities, they're not seen for 10 years. There's often like a stigma associated with mental illness. And I'm going to show you a short film about that in a second. There's also culture and religious barriers. There are many cultures, nationalities, and religion that frown upon therapy. And they don't want, they feel like that it's an admission that they don't have they don't believe in a deity. Their culture believes in like toughing it out, whatever that means. And also reasons why people don't get treated is because they don't have access to mental health care treatment. And some people want to get therapists that look like them, and therapists of color and people that specialize in certain things are often scarce. And we'll talk a little bit more about that later. And finally, I'll talk about what I call the Facebook facade. But what it really means is this part of our culture whereby we don't want our kids to get help, and we're scared that if they get help, then they're not perfect. And people do is sort of like put their PR kid online, which is that the kid that they hope for. And they put only good news up there. So we're all feel like that if something's going on with our kid, that something is wrong with us because our kid doesn't look like the kid that's up online. So no one wants to admit that a lot of that is on social media is a facade, but it keeps people from getting help because they feel like that they're outliers and that they shouldn't get that something is wrong with them because they're not like the other kids. Okay, I'm gonna stop and look at my chat. Danielle, can you read that question for me? Oh, okay, that's yours.
Absolutely. I just wrote something, but someone agreed with you and said, this is so true. Thank you for addressing these concerns.
Yeah. So what are we facing with COVID, right? Mental health, a lot of additional mental health care barriers. Offices, people have closed their offices. I've been in my office 6 times since March. Programs around the Beltway that help, like day programs, day treatment facilities, intensive outpatient, things that the county and all of the people that we know recommend for certain kids who are really struggling. They've been curtailed since COVID. Some of them are open, but they have limited capacities. And the schools have been closed by and large. There are some people that are back on hybrid, but mostly the schools have been closed. So kids don't have access to their school counselor. All practitioners that I know are backlogged. Online therapy is certainly not optimal, especially if you have a kid who's already struggling with online learning. And then how do you in my office, when I used to see really young kids, I'm on the floor with them and I'm playing with them. I'm not talking to them. So online treatment is possible. And I have some colleagues who are very good at it, but it's not optimal. Especially because even the older kids have online fatigue by the end of the day. They do not want to be online with anyone else. Yes, there have been some studies, and particularly in regard to teenagers, and the studies pretty much back up that online support for teenagers can be effective. Now, what I want to say though, Rena, is that I think it depends on what issue your child is dealing with or what issue the child is dealing with. And sometimes it would be good to assess them initially in person. So that even if you go online, like a lot of times I really want to look at the kid face to face. And obviously I'm doing that mask right now across the room from someone and doing an initial assessment before I make the decision to put them online. You also have therapists that are tackling their own family issues around COVID, particularly around child care, elder care. People are telling me that their relatives have COVID. So they're having to deal with their own life. And a lot of times that's resulting in them doing less therapy. So usually around therapy with some people, there are several reasons why they don't get it. They feel ashamed to admit that there's a problem. So they're oftentimes concealing the problems. And then they think that there is a stigma. And they don't want their child or themselves to be designated as having a mental illness. And they feel like that their communities would not be accepting of it, or their church might not be accepting of it, or their synagogue might not be accepted of whatever community group that you all belong to may not be accepting of a or of a mental health diagnosis. So shame plus stigma equals silence, right? People just don't go to therapy. So I want to show this short tape by Jay-Z. Let's pray that it plays. Will it play, Danielle? Okay, let me know.
So if you go ahead and share it, but there's a button once it comes on, once you pull it up, there should be something, once you share it on the screen, there should be something that says click audio or something.
Okay, do I have to go back out to do it though?
Yeah, I don't think so.
Okay, so it's not up at, is it up at the top? Oh,
Yeah,
share sound. Okay, they added that. They changed that. Okay, great. Let's see if we can hear it.
Okay.
Mental health, trauma, PTSD is so rampant in our community. But, as scared as Black folks are of the cops, we even more scared of therapists. Like, we're not trying to go to therapy.
Yeah, it's a stigma.
It's a stigma. It's a stigma, and people are dying. You went to therapy. You talk about it. How did you get over the stigma? Of going to therapy and then talking about it, because you might save a life just talking about that.
Well, as you grow, you realize the ridiculousness of the stigma attached to it. It's like, what? You just talk to someone about your problems, And I think actually it should be in our schools. I think children have the most going on. Their mind are not fully developed, and teenagers, and you're drinking and you're doing damage to your brain, and all these things are happening to you, and you don't know how social anxiety and all these things are happening to you, and you don't have the language.
That's right.
You don't have the language to navigate it. How can you navigate it? How can you know when a guy is bullying you? All you have to do is say, "Man, you okay?" It could change the whole thing. So as opposed
those kind of tools and skills can get out of therapy, which we don't have enough of in our community. Mental health, trauma, PTSD is so rampant.
So what's some of the feedback that y'all have from that tape? Give me some feedback. What did it bring up for you all?
Something that was poignant to me is that students, whether they be children and or teens, just don't have the words to articulate what they're going through. And so it's imperative that, counseling is critical to support them in being able to articulate their feelings.
Yeah, that you oftentimes have trained therapists where, that are used to, like I've dealt with a lot of middle schoolers and teenagers and understand their rhythms, and I'm able to relate to them. And sometimes they just will not talk to their parents. So you have a therapist is crucial. So that brings me to like another barrier, which is affordability. Therapy in this area costs in the DC area generally between maybe $125 to $150 to up to $300 and more per session. And if you can, that's without insurance. There are some insurance providers that all insurance providers provide mental health therapy, but it's hard sometimes finding someone on your insurance who has availability. When you seek to get reimbursement to pay someone who's not in network, then oftentimes that's difficult and involves paperwork. And when I talked about the therapy costs for DC, they were $150 to $300. Well, the psychiatrist, the ones who prescribe medication as opposed to therapy, their rates are even higher. So affordability is a huge issue. Availability is a big subject right now. It's very, very hard to find any therapist with openings. It's very hard to find therapists with openings in person. So we have like this situation where we don't have therapists with openings. If you need a particular specialty, like someone who does DBT, which is dialectical behavior therapy, or someone who treats eating disorders, they're in a short supply. Therapists of color are also scarce. So if you're looking for a Hispanic therapist or a Black therapist, it's very, very hard to find them. So another barrier comes from within. With parents, sometimes when things are not going in the way that they would expect with their child, or things are not going well, it's hard to think about the child that's in front of you. The child that's in front of you, we have all of these fantasies about how we want our child, what we want our child to be, how we want them to act. And we have these fantasies in our head, but sometimes it's hard to recognize the child that's in front of you. And so because we have difficulties, then we have a hard time getting that child help. So we have to come to the realization that the child in front of you is an amazing, wonderful child. They just may not be the one that you had in your brain and in your dreams. But that child with support can stand on their own, but you may be at a point where they need support. Also, understand that the influences of your upbringing. So understand how you were brought up. You might have been brought up in families that didn't take very seriously, or didn't value mental health care, or thought therapy was a waste of time, or you might have been brought up in a family that treasures therapy. So understand that how you think about therapy for your child has a lot to do with how you grew up and what you grew up learning. So someone wrote in that they lacked therapy for family members for years, tried to find it, then found some that took insurance, the turnover is high, but now they have a good therapist, but it's expensive. Yes, I fully agree with you that it's very hard to find a therapist that you can afford, and it's very hard to find them on insurance. And so I fully agree with you there, but I'm so happy that you found therapists that work for you. But again, I acknowledge that it's expensive. And finally, your internal work has to do with if you need support, because sometimes your child might need support, but your coping mechanisms and the way that you're handling things and the way that you're seeing your child might mean that you might need support yourself. So a lot of times when I'm interviewing parents, I sort of get a gauge of how they're doing, and I can make recommendations to them about getting supports themselves. So I'm going to leave you with the last slides I want to leave you with are about how to get help. One is to try, if you can, to get help as early as you can in the process. And the way that you do that is that you understand. So if you have a child that has some mildly depressive feelings and they're 7, if you got treatment for them when they were 7, it would be a lot more, your outcome would be a lot better than if you get treatment with them when they're on their way off to college. So make sure you get help early. Understand that mental health problems are variable. So that means that, you might come to me and you might say to me, well, how long is it going to take for the kid to get better? Well, that depends on the kid, their willingness to do treatment, the problem that they're having. So like questions about length of treatment are oftentimes harder to answer earlier into treatment. A lot of times when I've been seeing the child for a month or two, I'm able to give the parents an honest assessment about the length of treatment. Again, utilize your school-based support. Even during COVID, send a message to your school counselor, your school psychologist, the social worker, whatever resources you have at your local school. Reach out to them. There are also, if you can't find individual therapists, if your child has an issue that is amenable to group therapy, like social skills, people are running online social groups and distance social groups. So please look into those, and make sure your child is taking care of themselves. And what I mean by that, I mean getting out of the house, getting sunshine, exercise, sleep, making sure that they're not in their room 24 hours a day, 7 days a week, which is a sign of isolation. Finally, one of the problems that people have with getting help is that when their child is anxious, they don't want a therapist. So sometimes anxiety is help refusing. So you have to enlist a therapist or someone to help you to get your child to the point where they even will deal with treatment. So the nature of anxiety is sometimes help refusing. So to acknowledge that and to get them help. How do you find people? You get referrals from your friends, other mental health professionals, ask your pediatrician, be persistent, leave them messages, an email message and a phone message. Call as many professionals and see who calls you back, then call them back. If they don't call you back, get another list. If practitioners are taking wait lists, put yourself on the wait list. I don't do wait lists because I want to get people treatment, but a lot of professionals do. Contact and keep contacting your insurance companies to see if they've added providers, tell them what you want, and continue to just get on their cases until they get it for you. Also, even if you're paying out of pocket, some therapists will file your claims for you. Like I file claims for people, not me personally, but a biller. So it makes it a lot easier when you're seeking reimbursement. And consider other professionals. For example, I'm a psychologist, but I may not have openings. So you might want to consider a master's of social work. You might want to consider a licensed counselor. Likewise, psychiatry appointments for medication are difficult to procure right now. And so there are these things called nurse practitioners who are able to prescribe medication. So look at all of your options in terms of who you're going to get to treat your child. And sometimes you might have to get people that are interim until you can get who you want. Have your pediatrician or somebody who knows the therapist call a therapist to see if you can get them to talk to you. Some of you might have health savings accounts that you might be able to utilize to pay for treatment, and you can at least get your treatment taken out, your HSA or taken out pre-tax. So it gives you a little bit of savings there. Okay, someone wants me to break down the various treatment options and what they are trained or specialized in. What's the difference between a licensed counselor and a therapist? Okay, I will answer that question. So let me finish this list first, and then I will answer that question. Also, you can have programs at your church and community groups that provide support to your teenager or child who might be dealing with a specific issue or might be recreational, and help them with the isolation. So utilize all of the tools in your arsenal.